Good morning or afternoon, everyone, depending on where you are. This is Sophia Shepard with JBS International, and thank you for joining us for today's Getting Started on Your NAS Initiative webinar. Before we begin, I'd like to review some housekeeping items. Due to the high number of participants on this call, all participant lines will be muted for the duration of this webinar session. If you have any comments or questions, please submit them at any time by using the Q&A feature. To open your Q&A window, please click the Q&A icon located in the bottom center of your Zoom window. If you experience any technical issues during this webinar, please message us using the chat feature, which is located at the bottom center of your screen, or email us at arcor-ta@jbsinternational.com. We request your participation in a short evaluation survey that will be sent via the chat box towards the end of the webinar. We thank you in advance for your participation in this webinar as well as the survey. Lastly, this is a recorded event and your participation grants consent to be recorded. The recorded webinar and PowerPoint slides will be available and sent to participants at a later date. Today's presenters are JBS Technical Expert Leads, John Roberts, Sharon Morello, Carrie Earl, Sue Gadach, and Teresa Lemus. John, I'll turn it over to you.
Thank you, Sophia. And I'm going to just show you this overview slide and then very quickly get out of the way here. So we're going to talk about a bunch of different things today. Sharon Morello is going to start us out talking about some of the focus areas that you have chosen as a group, so you can see as a grantee cohort where you stand on focus areas and some of the strategies that you've chosen. Carrie Earl will do the collective impact approach to developing your consortium. And then Sue Gadach will move into talking about developing logic models. And then Teresa Lemus will finish off with talking about effective strategic planning. And then we'll have time to do your questions, which, as Sophia mentioned, if you put in the Q&A, I will grab those and read them to the facilitators. If you have a specific question for a specific person, for example, if it's about collective impact and you want to flag that for Carrie to answer, you can do that too as you put your Q&A in. So again, welcome. And at this point, I'll turn it over to Sharon.
Yeah, thank you, John. Hi, everybody. My name is Sharon Morello. I'm a technical expert lead at JBS International and a nurse. I live and work in Rhode Island and have been working with substance use disorder for the past 40 years with a specialty in opiate use disorder and medication for opiate use disorder in pregnant women and their babies. Next slide, please. So we're going to talk about areas that you've selected, the cohort breakdown and the focus areas that's been selected by your group. These were the areas that you can see in front of you on the slide and the areas that you had to select one focus area. There were a couple of grantees that actually selected 2 areas to focus on. And you can see in the big blue section, integrated care, that was the biggest percentage of grantees who picked that particular focus area. And the second runner up to that was family support. So you can see 3/4 of that pie is around integrated care and care coordination and family support. 2 things that go really well together, and we can see that many of the grantees pick those. When we looked at the whole, and I analyzed a lot of the focus areas and looked at what areas people picked, it really related so nicely to their needs assessment, to where their community was. So when we're working with family support and integrated care, those are big pieces and important pieces for our technical expert leads to see where a lot of the energy will be focused. But that workforce, transportation, telehealth, and criminal justice pieces to those communities who pick those focus areas is as important, even though it doesn't take up a big piece of that pie. And the exciting thing that I think about this cohort and the grants that you've had coming up for the next 3 years is that there's 30 of you and there's only 3 technical expert leads. In my experience right now, having that small cohort with a group of experts who can also talk to each other and serve you well will be an unbelievable way for you to gain information over these next 3 years. And even if you have not picked a particular focus group, one of the groups in your cohort has and can share information best practices and lessons learned and what worked well is a great opportunity for this grant cohort going forward. I'm excited for you and congratulations to you getting this. Next slide. So these were the prevention strategies that popped up in your cohort. So we have strategy 4 is the one that came up as the leader of the pack. Coordinate and the delivery of evidence-based prevention services and education programs to groups within the target population that you have picked. And then, of course, runners-up 1 and 2 come in strong. All of them have relationships together. And at the end of the day, in prevention, when we're looking at 3, we're talking about facilitate proper medication safety and disposal. For those who picked that particular strategy, it was so important as it related to their community needs and what was happening. And we can all learn for things that are going to be present in the prevention strategies, and knowing who they are and what your technical expert leads can help you to support those strategies will be extremely significant going forward. Next slide. Treatment was a little bit bigger of a deal. We had 8 possibilities to pick for treatment strategies. You only needed to pick 2. And the most popular treatment strategies that were picked were actually number 4 as number 1 and 1 as the second runner-up. And 1 and 4 also go well together. So we find that there was a lot of thinking when people picked a strategy under treatment. The 2 that they picked, no matter what they were, met the needs of their community best, and they actually interrelated to each other so well. So look at 1 and 4. Educate on best practice that improved the engagement in our early intervention of women of childbearing age into treatment, and then improve engagement between the target populations and behavioral health services through cross-sectional collaborative programs designed to increase points of service and entry. Those 2 go together hand in hand, and you can see on the strategies picked that they're on top on the list. Certainly 2, 5, and 6 came up as runner-up for number 3, but all of them are well weighted and working together to form treatment strategies that we can work on. Also knowing this, as the TELs look at where the themes are and where things are identified, they can also increase what the need is for TA, looking at themes and looking at strategies to help you along your way. Next slides. The recovery strategies were 4. You needed to pick 2, and you can see here that they were picked in order, 1, 2, 3, 4. And the first 2 are pretty interesting because when we look at recovery strategies, looking at improving community understanding of support for different pathways in recovery. This is a real significant strategy, not just for recovery, but also for treatment. We know that many times when people consider recovery, they think of recovery sometimes only in an abstinence model. And in order to get to recovery, there needs to be an abstinence pathway. And what we're trying to do across the country and across different cohorts and across different communities is to try to educate as best we can that there is different pathways to recovery and that somebody can be in recovery and still be on medication-assisted treatment at the same time. And that is a strategy for recovery that is still well-versed in many areas that needs to continue to stay, not only to support recovery services, but to support treatment services. Second one is enhanced discharge coordination of the target population. When we look at people leaving, anybody leaving, not just pregnant women, but anybody leaving a 24/7 residential type of setting, whether it's hospital level of care, residential level of care, leaving postpartum after a birth, or being in a detox facility, coming out of a criminal justice system, anytime somebody leaves a setting when they had an opiate use disorder prior to and leaves that setting, the chances of right now of them overdosing or having reused within a short period of time are 95% within about 48 hours of discharge from that inpatient facility. That's our highest rate of potential overdose and our highest rate of usage. In a pregnant woman, that could really mean so much more. So having that discharge coordination from those kind of levels of care are significant. And those are the 2 pieces that pop up really clearly in this recovery strategy. The one thing I just like to mention before I introduce Carrie is to say that at the end of the day, there's 3 things that pop up for me when I read all your strategies, and I pulled all the analysis out to see what treatment strategies, what prevention strategies, what recovery strategies are we really looking at. 3 things popped up that were themes that I saw throughout all of them. And the first one is engagement and access. If we don't engage and we don't have access, then all of these things for recovery strategies can't ever possibly come into play. So we need to engage and we need to have access. I saw across all the strategies the necessity to have best practices and evidence-based practices. We have to do science to service. We can no longer just think or feel or have feelings about something. We need to use science, and we need to use it to do the last theme that comes across through all of your grant language. It's educate, educate, educate. Behavioral health, educate hospitals, educate nurses and doctors and social workers and clinical staff, our community. There's not one part of our community that doesn't need this education. And that showed up as a consistent theme throughout all your strategies throughout. I'm going to introduce Kerry Earl, and she's going to present the next couple of slides around collective impact.
Thank you, Sharon.
You're welcome.
So I'm Kerry Earl. I am also a technical expert lead with JBS, and am based in Reno, Nevada, and have been working with this population since the mid-90s in a variety of ways through both a state prevention coordinator role, direct clinical service, and community-based organization leadership as the CEO of an organization that served pregnant and parenting women and their infants and family members in residential and transitional housing capacity using a pretty innovative collaborative model. And so that feeds into this focus, which is going to be kind of just a quick 101 overview of what collective impact is and how it can help you think through your consortium, even if you've been together for a while, but also if you're just forming and starting to look together at how you plan. Next slide. So what is collective impact? This was a framework that was originally set out and defined in 2011. So it's been around for a while. And as I said, it's likely that you're familiar with these concepts, and some of you might be, real expert at this, but it's a pretty practical approach which focuses on sort of these 3 main goals: that there is a group of folks that are from different sectors that are also committed to solving, that have a common agenda for solving a common problem or a specific problem, and that it's not just any coalition, it's a very structured form of collaboration, similar to what you all are setting up through this grant award. Next is that it's focused on collective goals, plus strategic partnerships, plus both collective and independent action. And we're going to talk a little bit more about that, that's aligned with those shared goals. And it defines a shared accountability process that's supported by a backbone organization, which is sort of the institutional warrior, the person that, or the organization that provides the leadership, the connections, the glue for the process and the project. And finally, that collective impact hinges on the idea that for organizations to create lasting solutions to social problems on a large scale and a population scale, that coordination of those efforts is necessary in order to achieve a clearly defined goal. One fun fact is that Wikipedia's philanthropy, the second favorite word for for philanthropy in 2011 was collective impact, which for me, I think that's telling from the standpoint that funders see this as a very valuable approach. And since then, it's been repeatedly demonstrated through data to be effective. And effective means being able to measure that population level change and systems level change, which doesn't happen quickly. It can take anywhere from 4 to 10 or even more years, depending on the scope of the work. But it has been proven effective. Next slide. So there are 5 conditions necessary for achieving collective impact, and we're going to go through very briefly each one of these to define them. And I would encourage you, as we're talking through this, to just think about how you have either already incorporated this and can flesh it out kind of within this collective impact framework, because much of how the grant application and the NOFO was designed leads you to some of these conditions. But in some cases, they may not yet be fleshed out. And this is, I think, we're hoping that you can look at how these conditions are playing out right now in your work as you're getting started, and how you can use them to shape your 6 months of planning work. Next slide. So first, the common agenda really speaks to that all participants have a shared vision for change, including a common understanding of the problem and a joint approach to solving it through agreed on actions. That really is the model that we're here to talk about today as we queue you up to start looking at developing your logic model, which will then inform your strategic plan. And so if you haven't already, through your grant application process, been able to articulate that shared vision for change, this will be an important starting point and will help guide the rest of your process. Next slide. Shared measurement. So partners use a common set of measures to monitor performance, track progress towards goals, and learn what is and is not working. And this is probably one of the most fraught pieces of the collective impact framework, in the sense that when you are bringing together partners from multiple sectors, there are different types of data that are collected. There are different ways to define success. There are different languages used and data elements used and different systems to track that data across partners. And so this can get complicated. There are also ways to use your logic model and strategic planning, and Sue and Teresa are both going to be talking about that much more, so I'm not going to dwell on this, but really to use those tools to help you define the priority measures that you feel like are really going to help inform you and your partners as you move through implementation, to understand if the interventions that you've chosen in the areas of prevention, treatment, and recovery, and within your focus areas, are in fact working. And if they're not working, how do you correct course? How do you shift gears? So we will be here to provide you with support as you move through that process, but want to acknowledge that there are a lot of good ways to do this, things like shared data dashboards, ways to help communicate that. We'll talk a little bit more about that in a second. And that we also recognize that it can be complicated. And particularly in rural areas where data is not often easy to find for at a population specific level. Next slide. So the third condition is mutually reinforcing activities. And this is, participant activities must be differentiated while still being coordinated through a mutually reinforcing plan of action, which is your strategic plan. And this really just speaks to the notion that each partner will have a specific role and set of tasks within your strategic plan, and that the plan itself is a mechanism, along with your backbone organization, the mechanism for coordinating those activities, so that sometimes you will be engaging in shared activities like particular community fairs or prevention activities, education and trainings could be shared. And then there will also be very specific tasks and approaches. The treatment providers will have a specific set of goals around engaging folks in medication-assisted treatment and prenatal care, while there may be partners that are operating differently in the background to support improved access and engagement, as Sharon mentioned. Next slide. Continuous communication is critical, and the definition here is that consistent and open communication is needed across the many players, not only to build trust, but also to ensure that you are in fact engaged in shared framework with mutual objectives, and that there is a common motivation for doing this work, which is not easy work. And so there are a lot of different strategies to support a continuous communication condition. That could be a combination of direct reach outs on a one-to-one level between the backbone organization and the partners. It could be a shared newsletter or email blast or other kind of social media, however you're connecting, whether you're using certain shared platforms to engage in work that everybody is participating in. There are going to be a lot of needs to make sure that your communication is fluid and consistent. And we've learned through the last 6 months of the pandemic that we have to get creative with our strategies around this now that we are limited in the ways that we can meet and work together. So I would encourage you to use us to help you brainstorm with this if you start running into challenges, because without this level of communication, you really do lose some important glue in the process. Next slide. Backbone support. I've been referring to this throughout. So your lead organization is one of the other necessary conditions. Creating and managing collective impact requires a separate organization with staff and a specific set of skills to serve as the backbone for the entire initiative and coordinating participating agencies and organizations. And I have certainly learned through the years and the work that I've done with states and tribes across the country that are looking at bringing together multiple systems to support policy and practice change that will improve the ways that these systems who are designed to support families that are impacted by substance use disorder to really, that work gets very complicated, and there are a lot of partners and potential partners. You may have a core set of partners at the table, but also be looking ahead and looking out to a range of other folks that you're going to bring into the work to support you in meeting your goals. And without a coordinating entity to really be the orchestra conductor, the impact of those activities is muted. So we want to really support you as the lead organization, along with supporting your partners in ensuring that you have what you need to do this level of coordination. Next slide. So as you think about aligning your priorities, strategies, and resources, here are some kind of thoughts to consider to help you look at where you're starting from and where you need to move to in order to be successful at creating this collective impact approach. What are the key questions that you are going to need to be able to answer in the next 3 to 5 years? You know, looking ahead past even the period of this award and the implementation process that you're going to be employing, starting with designing your logic model and your strategic plan. What are you looking out ahead at? What possible funding changes are in the near or even distant future? What are some of the population dynamics that might be changing in your community? Are folks moving in, moving out? Are you finding your workforce is changing? So really just thinking broadly about what the next 3 to 5 years is going to bring so that you can incorporate that into your strategic plan through a SWOT analysis, the strengths, weaknesses, opportunities, and threat, looking at that. And I think Teresa's going to talk more about that. What shared priorities have you identified? Obviously, with this grant award and your successful application, you have identified those shared priorities, but it's likely that you are going to now use your time in this next 6 months planning period to refine those priorities and really ensure that they map across the different systems. For example, many of the women that you're going to be serving are going to be referred into services from systems like a criminal justice system or a child welfare system or potentially a treatment provider. each of those entities, while being interested in a certain outcome, whether it is recovery or child safety or reduced criminal activity, have specific mandates in those systems. And while those priorities are all potentially in alignment, they can also be potentially competitive. And so it's really important to think through your plan in a way that doesn't alienate a partner or create an imbalance in your approach. How can your resources be streamlined? In addition to the resources this grant is offering you, what are the existing resources that you're leveraging? And how can you move those all in the same direction? And then I've already addressed that notion of defining your success, selecting metrics that will allow you to understand how your interventions are going to impact and move the needle for your service population and for your community. And then how do you communicate that? And finally, how do you need to shift your operations in order to support and facilitate coordination and joint accountability? Where are some of the things that are currently in your way that might not be allowing you to do that in the most effective method, whether that is location, whether it is agency policy or information sharing tends to be a barrier that collaborations really need to kind of work through to figure out how are you going to share information that is sensitive and protected by HIPAA and 42 CFR to both coordinate and report on your progress in a way that holds you all jointly accountable. Next slide. So in addition to those 5 conditions for collective impact, these are the preconditions. And for those of you that have already had your monthly call, you know that we're talking with you about this. Who is your champion for your focus area or your champions? You need to have those folks who are able to influence the community and partners. And in cases, you'll as you start engaging with state agencies that have a role, whether that's Medicaid or your public health, your state public health agency or your state Office of Rural Health, you're going to need to have your on the ground champions that can connect you to the right places to make your impact. Adequate financial resources is certainly a precondition, and then the urgency for change. And I think that this NAS initiative is so exciting because it really does cue this up to be the preconditions for the way that you are working together the next 3 years and beyond. And next slide. So these are some considerations for those preconditions. How will you sustain leadership and coordination? So start thinking about that now, because the 3 years is going to go fast. And you want to be able to build in at the front end of your plan considerations about your leadership and coordination that go beyond the funding. Adequate financial resources. To what extent have you explored already your private and public partnerships looking towards sustainability? Where are the areas that you haven't mined yet? And what can you start to look? So some of you in your applications have said you're not engaging Medicaid yet, but you have a plan to do so. What are some of the barriers for that? What help might you need to make that relationship happen? What kinds of financing issues are you already identifying that you're going to need to have certain partners at the table to resolve? And what are your existing resources? How are you going to keep those a current map over time? We hear a lot from communities and states that this is a big challenge, that it's a challenge to understand and communicate what already exists for pregnant and postpartum women and their families. And so just even knowing what already exists, let alone keeping that up to date, can be a pretty daunting task. And to the degree that you have a way to utilize your partners to help support that activity so that you know where there are the leveraging points. This is an important time to get that set up. And finally, urgency for change. How do you track and communicate to your decision makers, your policy makers, your key stakeholders, both what needs to change and also what works well and needs to continue to be supported. So keeping an eye on that ball is going to be important. And with that, I am going to hand it off to Sue. I think that's my last slide. And Sue, I'll hand it over to you to talk logic models.
Very good. Thank you so much, Carrie. Good afternoon, everyone, or good morning. My name is Sue Godach. I am actually located in Milwaukee, Wisconsin, and like my colleagues, I am also a TEL from JBS. I have over 30 years of experience in health and human services, and the majority of that has been working with women with dependent children, and pregnant women in the development, design, and implementation and evaluation of prevention, treatment, and recovery programs. So I hope I am able to help you, and I am here to help you. Next slide, please. All right, so if you are a visual person or a visual learner, you will probably like logic models because it actually does allow you to see your program, your initiative, and its anticipated development. Logic models definitely help us plan, implement, evaluate, and communicate more effectively. And your evaluators, probably the person who you've identified as your data coordinator, have probably used logic models. And believe it or not, logic models are really old. They've been around for an incredibly long time. You probably use logic models all the time and you don't even realize it. Let's say, for example, you're suffering from a headache. Your experience tells you that certain pills help. So a logic model shows you that you first need to get the pills, then you take the pills as they're prescribed, and as a consequence, you feel better. In the end result is that the headache goes away and you're feeling better. So you get the pills, you take the pills, and you feel better. Now that's incredibly simple, I get it. But one of the things is to be able to start to get into a routine of applying logic to your program and the initiative that you are trying to develop. You will be developing your logic model as part of your program planning. And logic models truly do help not only you, but your consortium work on outcomes in a more concerted or agreed upon way. So in short, logic models serve as a visual diagram, and it illustrates how your program will address an identified community need by communicating your resources, your activities, and your goals. Next slide, please. All right, so these are the traditional elements of a logic model. If you have the name of your program, whatever it is, but the goal of your program, and probably for the NAS initiative, your goals may be something similar to like reducing the NAS rate in your region, or improving access for women-specific treatment, or improving engagement for women to be able to get into treatment. Your situation is really what that community need is. So, and your situation needs to be specific. So this is where you're going to begin to talk about your data and how you embed your data. So your situation might be that your region has an NAS rate that's 2 times the state average and 4 times higher than the national average. Your inputs are data. So where did you get that information from? What are the data sources and the reliable data sources that you can use and continue to go back to show improvement? So they are also, inputs are also resources that you have. It might be financial resources. It may be your staff. So your program director also may be an input, or the people that will be providing services may be an input to you and to your program as well. So they're all the ingredients that go into the development of your program and your initiative. Outputs are divided into two different categories. So outputs are your activities. So they may be your prevention, your treatment and recovery activities. And participation are the groups of individuals or the target population that may be of a benefit or a recipient of those listed activities that you have as an output. Outcomes are divided into three specific areas, and it is gauging the type of impact that you anticipate. What is the short-term impact, the midterm impact, and the long-term impact? Okay, next slide, please. All right, so we're going to stay on this slide for just 1 minute. Number one, I like looking at it, yum. Secondly, what we're going to try and do with this slide is really begin to say, how can we apply a task that is pretty well known to most of us, like baking cookies, and really begin to use it as a logic model? So when you think about logic models, again, our three main areas are inputs, that's our staff, data, ingredients, our outputs that are divided into two different areas, activities, your participation, so who's benefiting from those listed activities, who is your target group, and then outcomes, what are the impact, the short term, the midterm, and the long-term impact. So we're gonna need to say goodbye to the cookies. Okay, next slide, please. Now, these are traditionally the elements that go into baking cookies, all right? Traditionally, these are the elements. You have things in here like chocolate chips and your cookie baker and, you know, full cookie eaters and your dirty kitchen. I know I'm a rally killer, but a dirty kitchen. But one of the things is with what you're doing with your logic model is you are trying to look at all of the things that go into the development of your program or your initiative. And for this one, it's into the development for baking chocolate chip cookies. So your situation is you have kids that are hungry for your delicious chocolate chip cookies. So taking a look at these elements that are listed here. Sophia, can we pull up the first poll? Please. There we go. All right, so this is one of the elements, measure ingredients. What do you think that it is? Is it an input? Is it an output? Or is it an outcome? Please vote. Vote quickly. 5, 4, 3, 2, 1. Our poll is closed. What did everybody say? Measure ingredients. Measure ingredients is actually an output. It is an activity. Measuring ingredients is an activity. So the one thing to keep in mind is that as you continue to work on your logic model, these types of categorizing these things are going to be important. So let's do another poll. All right, our second poll. Sophia. All right, we've got hungry cookie eaters. Our hungry cookie eaters, are they an input, an output, or an outcome? 5, 4, 3, 2, 1, and end the poll. And what did everybody say? Hungry cookie eaters, it's actually an output because your hungry cookie eaters are the participants that are benefiting from your activity, okay? So this is good. Actually, this is good. I was trying to trick you, but this is good. All right, let's close this and then let's move on, because what I want you to see is all of these elements put into a logic model for baking cookies. Okay, can we go to the next slide, please? Okay, so here was your situation. Your kids are hungry for chocolate chip cookies. Your inputs are the people, your cookie baker and your baker's helper. That was from the list of the elements, and then all of the ingredients. Those are your inputs. Those are the tangible things that you have. And output are your activities. So these are all of the activities that you are engaging in order to begin to bake your cookies. You're mixing things together. You're measuring your ingredients. You're going to bake the dough. You're dropping it. Your participation or your participants are the hungry cookie eaters. Those are those kids that are hungry for chocolate chip cookies. Outcomes are broken down into 3 separate areas based on its impact. Your short-term impact is those hungry cookie eaters will start eating those cookies. They're eating them. Midterm, yum. They love the taste of it. And of course, me being the rally killer, we have the dirty kitchen again. The longer-term outcome is that you've got full cookie eaters. You got a happy baker. See, she's smiling down there. And then one of those baker's helpers decides to open a bakery. So that's a much longer-term outcome. But the one thing to keep in mind is that this is something that we can all wrap our heads around, all right, baking cookies. And it's how to be able to begin to take these sort of strategies and these sort of activities that we have familiarity with, and then transition it as we begin to do logic model development for our program and our initiative. Next slide, please. The one thing I want you to keep in mind is that there is no single way or a right way to develop your logic models. I have seen and worked with organizations that have done many types of logic models, horizontal ones, linear ones, circular ones that look like the gears in a watch. The one thing is to keep it focused on your purpose. And for right now, the goal of this is for your planning. That is what we're trying to do. Your logic models need to convey information that is meaningful and understandable to its users. So if it is your core team and your consortium, your community partners, that's who needs to understand it. The one thing to keep in mind is that your logic model will probably never be an exact representation of your program. It will never show all the detail. There was probably somebody that was looking at the cookie baking logic model that said, you don't have a bowl, you have no spatula or no wooden spoon. How are you going to mix everything together? Okay. Remember, it's merely a model. It is merely a model. Okay. So just keep this in mind. And this is how we're going to continue to help you as you develop your logic model. So we went through a couple different simple ones, the headache, the cookie. Now we're going to transition into actually doing program and initiative development. So next slide, please. When we're beginning to look at this, there's always external forces, and there's always assumptions that we need to keep in the back of our mind as we are developing our logic models. So logic models offer a series of if-then sequences. If you have X, then you should be able to get to Y. If you have Y, then you should be able to get to Z. So it's the type of sequencing that refines the causal relationship. So working out these types of sequences will help you uncover gaps in your logic, will clarify the types of assumptions that you need to make as you're developing your program, and help your audience understand how your investments are likely to lead to results. So work with me here. Let's look down at the bottom row for a second. Using the if-and relationship, this is the sequencing for cause. If you have certain resources, then you will be able to provide activities or produce services or products for your target group. If you reach those individuals or your target group, then they will benefit in a certain way in the short term. If those short-term benefits are achieved to the extent expected, then the medium-term benefits can be accomplished. If the medium-term benefits can be accomplished, then you would expect longer-term improvements. And some of those longer-term improvements may include health, improved or healthy birth outcomes, social, economic, familial, or environmental, those types of changes to occur. So that is really how you begin to embed those assumptions and then external factors as you're continuing to develop your program logic model. Okay, next slide, please. So we looked at these two types of logic models. So the one, the simple one was the headache, all right? You get the pills, you take the pills, you feel better. The more detailed one is the inputs. Then we did the outputs based on activities and participation in the short term and medium long term. When you begin to develop programs and initiatives, you have to start asking yourself those questions at the bottom. What are we investing? What do we do? Who are we reaching? What is the result? And for everything, it's what is the value? Okay, next slide, please. So this is truly what a program logic model looks like, in which you begin to identify all of the information that goes into this. Your situation, remember your situation. You might have an NAS rate in your region that is 2 times higher than the state average and 4 times higher than the national average. Where is the supporting data that validates the point that I just got done making? Who are the people that are involved in your help, in helping you identify that and being able to help you address your program needs? So your priorities, consider, did you develop a mission, a vision, values for what it is and the intended outcomes? Your input, again, what are we investing? Staff, materials, equipment, your partners, technology. Your outputs include your activities and then also participation. Activities, what are we doing? We're developing products, resources, materials. We are assessing, we're delivering services, and we're training. Who are we trying to reach? Moms, families, family members, agencies, decision makers. All throughout this, we're beginning to include the if-then sequencing based on our assumptions. As we continue to move on this horizontal path, we're looking at where those short-term impacts we may have in learning. Are we having an increase in awareness? Maybe we're trying to, maybe we've developed and have adopted the centering pregnancy model, and we're doing an educational session with our pregnant women about smoking cessation during pregnancy, or whichever substance. And there's an increase of knowledge as to what it can do as far as sudden infant death syndrome. And so what we're trying to do is to be able to identify where learning can occur. A midterm outcome is action. Does the person actually stop or reduce, usage of any kind during pregnancy? And then condition really begins to focus on family, health, region, agency, community. Maybe we have improved birth outcomes. External factors that need to be taken into consideration may be those external factors that you personally cannot change or your agency cannot change right now. So it might be that your state has an unborn child protection law, and where there can be, a civil commitment or something like that for pregnant moms that do not stop using. Maybe you are not a Medicaid expansion state, so services beyond the 60 days postpartum are incredibly uncertain. So when you think about, all of this activity that's going into the development of your logic model, it's, your activities, your outcomes, what are we investing, but what's the value and what is the ultimate goal and the intended outcome of what we are trying to do. Okay, next slide, please. So for logic model development, these are merely some suggestions that I believe have, I've seen pretty decent results with. Work in small interactive group settings that are collaborative and sensitive. Use everyday culturally appropriate language, person-first language. They're infants that are prenatally exposed to substances. They're babies first. They're moms. They're pregnant women with substance use disorders. If you are tripping up over those phrases of inputs, outputs, and outcomes, just let the words flow. we will help you in organizing that type of information, but I don't want you to get fixated on, oh my gosh, is this an input or is this an output? You know, sometimes the terminology should not be the biggest barrier to your ability to begin the development of your logic model. Okay, next slide, please. So logic model development starts with a shared sense of vision. It goes back to what Carrie talked about with collective impact. There is that common agenda. There needs to be, shared values, shared decision-making, shared vision. If this is lacking, the benefit of the logic model is likely to be minimal. Create a draft, revise it, and refine it over time. This is the one thing that I think is going to be the most critical. Identify a mentor, identify somebody who can look over your shoulder as you're developing your logic model, that has the permission to question what you're writing down. What are the strengths? What's missing? And question if you're asking the right questions about program theories and assumption. Please give them that permission and allow them to remain in that role. Next slide, please. So, logic model development, it's not quick and easy. It takes time. Remember, you're doing it for your whole program. It's prevention, it's treatment and recovery. Just as the graph shows that, or the picture shows that these people are putting sticky notes up on things, post your logic models where they can be seen. If you're doing it visually, use a PowerPoint slide and share it in Zoom or share it across email, however you guys are going to do it. But the people who are inputting information, even those with lived experience who you are trying to serve, probably should have some sort of input in what you are trying to design. Use your TEL, use us for ongoing technical assistance and support. All right, next slide, please. And then just in summary, even though programs are diverse, they all share common elements. All of you are trying to address neonatal abstinence syndrome in your area. And your programs have been developed in response to a situation. So this is how you are trying to react and respond to what your community needs. All programs have inputs, outputs, and outcomes, whether you use those phrases or not. And really what a logic model does is it displays the relationship among those core elements, and it brings attention to the underlying assumptions within a program's environment of external factors. And I know Carrie said it, and I'll say it too. You develop a decent logic model, and it's really going to be something that will help inform the development of your strategic plan. And with that, I thank all of you, and I am going to turn it over to Teresa to talk to you about strategic plans. Thanks.
All right, well, I get to wrap this up before we have questions, but just want to refer back to a couple of the things that that my colleagues have said, in that having a strong consortium with excellent communication, where members have participated in the development of the work to date and what's to come, is going to be really important. And the logic model, which is your first major deliverable, is going to really help you to develop your strategic plan. So we're going to talk a little bit about that and then have some time for questions. So I forgot to introduce myself, but I know John did it a little bit, but my name is Teresa Lemus. My background is also in nursing. But I have been working in the field of substance use disorders and in various ways for the last, I hate to say 30 years, but it really is about 30 years. And have been working with this and other populations over that time. So very near and dear to my heart, and I'm very excited to work with all of you in the coming years. So when we talk about developing an effective strategic plan, we're talking about looking forward. This is a process of putting pen to paper about, your steps and how you're going to get to where you want to go. So next slide, please. And you're going to use your consortium and the meeting of the minds to really have this be a cohesive guiding, hopefully, document that you will not only just share internally, but also with your stakeholders in the community. So you can see here that the due date for the strategic plan for the NAS cohort is, it's going to come up on us really quickly next year. And as the days kind of meld into each other, I think, you definitely want to start thinking about this probably before the holidays hit us. So you're going to submit a comprehensive strategic plan. And I love the little box over on the left-hand side that talks about high impact planning. An effective strategic plan provides clear, actionable direction for where resources and action should be focused. You're going to address the root cause of the problems with the most effective strategies and changes in organizational effectiveness needed to implement them. So you can read that, but I think that's really what we're going to talk about today, is trying to capture that and move forward with your strategic plan. Next slide. So in the FOA, there were requirements listed for the strategic plan, and I just put them up here so that you could see them a little clearly. You're going to address the gaps and barriers in the target service area related to NAS, prevention, treatment, and recovery. Incorporate evidence-based, promising, and innovative approaches. You're going to ensure affordability and accessibility of services to your target population that you're going to need to define. Detail plans to leverage existing resources. So that also will help us in as we talk about sustainability. Provide specific strategies for implementing the evidence-based, promising, and innovative practices, and develop strategies to reduce costs for treatment for uninsured and underinsured patients or participants. So when you're developing your strategic plan, you're going to want to make sure that you incorporate each of these areas into that strategic plan. So it needs to show up in the document that you submit to HRSA. All right, next slide, please. So a strategic plan, more than anything else, is really, it's a roadmap, and you're going to use your logic model to help you. That's really, I think, is a big chunk of work that is going to help the strategic plan writing go a lot quicker if you have an effective logic model. So you're going to develop a roadmap that's going to give you a picture of how you're going to improve the community problem or problems to keep folks moving in the same direction. And that's across different agencies, across, across your community. You've got a lot of variables that you're going to need to take into consideration, and provide a common language and reference point for everyone. And again, going back to something that Sue said, it's just really important that you've got, especially in this time of COVID where we can't, necessarily always sit across a table from one another, but provide some visuals for people to be able to see where do they fit in, and how can they contribute to impacting the problem that you identify. So next slide. The other thing that your strategic plan should do is to demonstrate to funders, stakeholders, and included in that is your target population, that you have assessed the community, that you have an understanding of the problem, you have a data to support that, and that you've planned strategies to affect the problem. And I think in order to do that effectively, you have to have a really solid understanding at multiple levels what the problem is and how does it impact individuals or agencies at various levels. So keeping that in mind as you go through the development of the strategic plan is important. Next slide. All right, so when you're when you start to sit down to work with your strategic plan, Carrie had mentioned earlier SWOT analysis, and that's certainly a great idea to have your consortium and other stakeholders identify, if you haven't already, your strengths, challenges, weaknesses, opportunities, and threats. But planning starts with a problem statement. And so we're going to go into each one of these, but I just wanted you to have a visual framework here. And if you'll go to the next slide, we can jump into each one of these specifically. So problem identification is important. What does the data say that you have been able to gather? That can be from stakeholder interviews, focus groups. It can be, with the individuals who are currently suffering and unable to access services. It can be from agencies. It should be from all of the above. But what does the data say? And does the data support the problem that you and your consortium have identified that you're trying to solve? So you want to make sure that you sort of look at all of these issues. The problem is well documented by the data. The stakeholders agree that the problem has negative consequences in the community. There's consensus that the problem is solvable, that you avoid placing blame because that can be pretty easy to do. Ensure the problem is measurable. If the problem is that there are too many barriers for women to access treatment for opioid use disorder, for pregnant women to access services, if that's the problem, then you want to make sure that you have a baseline. Avoid naming solutions at this point. Right now, we're just trying to say, here's what the problem is, and we want to try to solve it. And you want to name one problem at a time. So that will help you come up with your problem identification. Next slide. Then you want to identify your target population, individuals and groups affected by, involved with, or contributing to the problems or consequences identified in your problem statement. So these will be direct target population. So using my example, the target may be pregnant women who are suffering from opioid use disorder. But then the secondary or the indirect target populations who also play a very important role in how you go about solving some of these issues. That might be physicians' offices, it could be clinics, treatment agencies, it could be MAT providers. So you for each of your problems, you're going to want to think about the direct target population and the secondary. Next slide. And then we have our goals. Generally desired changes that are needed to address the problem statement. So you want to always go back and make sure that as you're working through this, and again, your logic model is really going to help, that you are addressing each one of the problem areas that you've identified. That goals should be specific and they should be measurable. So again, going back to the example that I was using, your goal may be to decrease barriers for pregnant women who suffer from OUD to access treatment. That may be a goal. And then you're going to want to even make it more specific, which we'll talk about here in a minute as you get into some of the objectives. So next slide. So when you're writing your objectives, you want to use the SMART objective rule of thumb, and that is to make your objectives specific. So specific meaning state exactly what you're trying to accomplish. We're trying to reduce barriers for this target population. Make it measurable. So establish a clear definition to help you use data that will help you measure progress. So if you are saying that there's too many barriers for pregnant women to access treatment, you're going to want to look at your data and see where you can measure an improvement or lack of improvement with data that you have. Then you go to achievable. Your consortium, and this goes back to what I think everybody's talked about this morning around the use of your consortium and those voices at the table to make sure that your consortium agrees that the goals and objectives that you set are achievable so that people feel like this is doable. So you want to make them achievable. Relevant. Do your objectives relate back to the problem statement? You want to make sure that they're relevant and that they are going to help you work through each one of these goals. And then timed. You want to set a time for completion. So as we go further down, we're going to talk about outcomes, which are long-term, immediate, and short-term, or intermediate, and short-term. So when you're talking about timed, you're going to want to think about, your overall time frame and then break that up to make it significant for you to measure across time. So go on to the next slide. And as Sue said, you know, your outcomes are going to be long-term, intermediate, and short-term. So when we talk about long-term outcomes, it's related back to the problem and goal, anywhere between 3 to 10 years. So that's a long-term outcome. And you want to definitely think about what your long-term outcomes are for this NAS cohort. And then move on to your intermediate outcomes, which are really about 1 to 4 years. And you also want to be thinking about the intervening variables and objectives that are going to impact those intermediate outcomes. So sometimes you're going to have you know, a lot of data that can help you make some decisions about what your goals are and what your objectives are. And there's other sorts of data, qualitative data, that are going to help you contextual things that are occurring in your community, or as Sue said, that you don't have control of, maybe at the state level. And those things are definitely going to help you think through what your intermediate outcomes are and help you establish those SMART goals so that it's achievable and measurable and relevant. And then short-term outcomes relate back to the strategies, and those are anywhere from 6 to 24 months. And so what you want to do is you want to set yourself up so that you are going back on a regular basis to look at your goals, to look at your objectives, and to look at your strategies, and go back and look at, is this working? So if your short-term outcomes aren't working, if you look at those and you say, wow, you know, we're missing the mark somewhere, it gives you an opportunity to go back and reassess. So we want you to really think about this as you develop the strategic plan. We want you to reach out to us and you know, ask for technical assistance. In many cases, we have examples where we can talk to you and show you to help you sort of get started, or to give you feedback on what you've developed. But at the end of the day, your strategic plan is something that's not just for you and the consortium, but really it can be a tool for sustainability. It should be a tool for sustainability, and it really also can be a tool for informing others in the community, other stakeholders, about what you're trying to do in your community, and perhaps bring them on board. So we want to help you write the best strategic plan possible, and just really look forward to spending the next, I think, about 20 minutes here, taking your questions and seeing if we can help you get started. So I think I'm going to turn it over to John, if I'm correct.
At this time, we will begin the question and answer segment of the presentation. If you have not already done so, please submit your questions by using the Q&A feature located at the bottom center of your screen.
Thank you, Sophia, and thank you to all the presenters. I know sometimes when we go through these materials and we go through a lot of material very quick, to me, it feels like we're driving past Mount Rushmore at about 90 miles an hour. And I think I saw something. So in thinking about that, just be aware that as all the presenters mentioned, your TELs are here to coach you and work with you through this process. So we will send the slides out. We will send the audio out as a start. And then you'll also be able to be in touch with them throughout this. And as Teresa said, we can help you with examples and help you work through these processes, so you don't have to catch it all today. So that's the first thing I wanted to say. And then from there, just be aware that again, the materials will be out to you pretty soon, and then we can always double back and go over this again. So let me check and see if there are any questions coming in right now. The other thing we know is that for 22 of the 30 grantees, you've already been through some of these similar processes with planning or implementation grants where you've done some of this work. So that's a great head start too. Also want to mention that some of the templates for these strategic plans, logic model, and information on the collective impact framework are coming out to you soon in an onboarding package that we're going to put out. So you're going to see some of this material again in a written format, and then eventually also again for visual learners in a learning management system that we're developing that we'll have online coming up in the next few months. So you'll see these things again, one in an onboarding package, and then two with some visual learning materials in our learning management system. Let me stop and just see from the presenters so far and going through this, did any of you all have anything you wanted to follow up on based on the flow of the presentation today, and anything that you wanted to mention that maybe you didn't have the time to do so as you first went through this?
I don't.
Oh, somebody just put something in there.
Yeah, so
Okay.
question, and this will be in the onboarding package too, but as far as the due dates of the logic model and strategic plans are both due in March 2021, or is this a staggered release of when these are due? So I will, I think Monica, if you can grab, do you want to grab that one?
Sure, can you hear me?
Yeah.
Yes, great. So,
Oh,
yes, both of them are due. Can you hear me?
No.
Yeah, you're
Robot?
Yeah.
yeah, a lot of static coming through. If you want to type that in too, or go ahead.
This is Sue. I'll just steal Monica's answer because I was on a call with her this morning. There is a draft of your logic model that is due with your first quarterly report on December 31st, but the final of both of those are due on March 30, end of March of 2021. But keep working with your TELs on the development of both, but there will be a draft of your logic model due at the end of December.
Okay. And another question that's coming about the logic models is how hard and fast is that framework as far as from the questioner, I always consider people and participants as potential inputs. Are inputs really only things, or they can be people too?
No, they are. Yeah, inputs are definitely people. So they're staff. The thing is to differentiate between who's performing and who is creating the work and who is benefiting from the work. So the target population, that is an output. Now, I don't want you to get tripped up on these phrases though, because that's the one thing. Just begin to start going with the flow of what you are trying to develop. That's the part that I want you to focus on. So your inputs, yes, they are staff. Yes, they are resources. They're, materials that you already have developed. If you've got a brochure for a women's treatment program in your area, that's definitely an input. It's your data. What are the data sources that you've been using to identify kind of your situation? But to differentiate between people, the input as far as people will be your project director, probably your substance use disorder counselors, your prenatal care coordinators, who's developing and who's going to be delivering those services to your intended population. Your target group might be pregnant and postpartum women. It might be women of childbearing age. It might be the family members of those individuals. And that's where you have to be able to differentiate. Your participants are those that are benefiting from the activities that you are designing. I hope that helped.
Yeah, thank you, Sue. So another clarifying question just about due dates is the strategic plan draft due at the end of December too? So we've got a logic model draft due, but is a strategic plan draft due at the end of December too, or is that a little bit later on, but prior to the March 31st?
And that one, I might be able to help Monica. So just the logic model draft is due at the end of December. And the reason for that is because we want to support you in being able to utilize the logic model to then help build your strategic plan. So rather than cram both deliverables at the end of March, we wanted to queue them up for you a little bit.
Yeah, and then I think our normal process would be then before the strategic plan is actually due, we would love to see a draft in a review period a couple of weeks before then, so we could turn it around and get any feedback to you. So that would be our usual process. I don't think we've got a specifically settled date on that yet, but you know, that's how that usually flows. And if you're familiar with the other cohorts, as most of the grantees are with turning in things and deliverables, as we do like to review them. So similar process here. We'll give it a minute and see if any other questions come in. And again, for as we kind of went through this quickly, you should be aware we'll get the onboarding materials out to you, and then your TELs will be available to you to coach you through this all the way through. Okay, well, thank you, everybody. We are available for questions. If you log off and then think of a question immediately after that, please reach out to us. That's fine. We're happy to talk to you about that. And as always, we'll be working with you throughout this process and going with you through the years on this. So thank you to all the presenters for doing such a great job and getting a lot of material in a short period of time just to provide that introduction and orientation. And we look forward to continuing to talking to you on your calls this month. And for those of you on the East Coast, we've made it to late afternoon, so we can move on to the next things going on. And for the folks a little further out west, hope your day is going well. And we look forward to talking to you again soon. Thanks very much, everybody, for participating today.